The beating in your chest is a good thing. Smarter Heart University and Dr. Scott on AM 970, The Apple.
Welcome back to your Smarter Heart University. Final segment. Answer to your pop quiz number 3. A man with moderate to severe erectile dysfunction has a 5% chance of heart disease in 10 years if he's only 30 years old. What percent, 20, 30, or 40% does he have chance that he have to have heart disease between 60 and 69? The answer is actually only 21%, 4 times more, from 5% up to 20%, going from 30 to 60. So still high, quadruple the rate. I mean, again, we know with age comes ED, but we also know with age comes vascular disease. So they walk hand in hand, and it's still worth. Again, I don't blame you for going for the high numbers for both of those two pop quizzes.
Well, it just goes to our relative ignorance in the vascular nature of this stuff.
We learn something every day, and we hope you do too. What you can do about it is always our fourth segment. Take the sexual health in men inventory test in men, the SHIM test, 5 items in 5 minutes to predict your future. Get your pencils out. I want you to count points up. Okay, 1 being the least, up to 2, 3, 4, up to 5 being the most on the following 5 questions. Number 1, how do you rate your confidence that you can keep an erection? Number 2, when you have an erection with sexual stimulation, how often was it rigid enough for penetration? Number 3, during intercourse, how often are you able to maintain an erection after penetration? Number 4, during intercourse, how difficult is it to maintain an erection to the completion of the intercourse? And lastly, number 5, when you attempt intercourse, how often is it satisfactory to you? I think this is great. There used to be 15 questions. They tailored it down to 5. And again, 1 to 5, 1 being the least answer to these questions, 5 being the most. So you give yourself a number and you add it up. And here's what you come up with. 22 to 25 points is no ED, no erectile dysfunction. 17 to 21 is mild. 12 to 16 is mild to moderate. 8 to 11, moderate. And 5 to 7 is severe. Okay, so the lower the number, the more severe the erectile dysfunction. High, over 22 points, that's not your problem from that standpoint. Why is this so important? Well, here's our 5 concluding points for today. Number 1, a significant amount of men with erectile dysfunction are going to have early signs of heart disease. I think we've proven that beyond a shadow of a doubt, folks, today. Number 2, to take that point one step further, 2 to 3 years of erectile dysfunction is going to produce a cardiac event in 3 to 5 years, especially if you're at least intermediate risk or higher. Number 3, if erectile dysfunction is found and you are considered intermediate risk or higher, a stress test or some imaging study, such as a coronary calcium score or a cardiac CAT scan angiogram or a cardiac catheterization, should be performed. And cholesterol, blood pressure, blood sugar, testosterone levels, as we talked about now, should all be considered because there's no guidelines to be testing for your risk. Number 4, weight loss and increased physical activity is the best treatment for erectile dysfunction. And the Princeton consensus concluded physically fit equals sexually fit. And I like that. Lastly, number 5, medical therapy for erectile dysfunction. Once your cardiac status or symptoms are improved or found and your exercise tolerance is established, is safe and highly effective for everyone. So there you have it. Public recognition and intervention between the healthcare professionals, us, and the patients, everybody out there, remains very, very limited when it comes to approaching this tenuous subject of erectile dysfunction and heart disease. It's still really, really limited. Folks, ED is a cardiac risk factor. I think we've proven it. I hope everybody passes this show and urges their friend and their relative to listen to this when we post it up on smarterheartuniversity.com within 2 days. As of all of our shows, we hope that you get a friend to listen, get a friend to join. ED, erectile dysfunction, offers a very early opportunity to aggressively reduce your risk and to prevent heart disease and death. Okay? Remember, you've got a 3-year window, okay, if you're just getting it. If you already have it, count back and see how long that has been. We kind of cut off there, and we always like to do our popular question. But again, I wanted to ask the expert, who's a co-director at Jersey Shore University Medical Center, in terms of the CAT scan imaging, about where this would play in.
I think it gets to, again, the risk stratification issue is if you have erectile dysfunction, and that should be a signal to evaluate your overall cardiac risk. And if you're found to have other risk factors, one of the components of identifying your cardiac risk is potentially doing a cardiac calcium scan to see if there's any calcium in the heart arteries, which may make you either higher risk, and in some guys who come in, they'll get a calcium scan, it'll be very low or zero, and that'll risk stratify you down to a much lower risk. So I think that's where it comes into. Certainly if you're having any kind of cardiac symptoms of chest pain or shortness of breath, maybe even a further evaluation with a CAT scan angiogram may be warranted at that point. But again, this is one of those risk factors that says, you don't have to have the chest pain the 3 years before you start having an event. This is your initial entry or your wake-up point to saying, not only do I want to get erections and have that treated, I want to know, am I going to have a heart attack?
Correct.
And what can I do about that?
Couldn't have said it better. And of course, remember, with the way healthcare reform is right now, the cost of these coronary calcium scans has gone up. Getting a cardiac CAT scan angiogram is, we have to jump through hoops and peer-to-peer reviews. Unless you're actually hospitalized, most university programs and most larger hospital programs have them. But you're going to have to determine by talking to your physician or your cardiologist whether or not you'd be a candidate for that, simply by just doing an exercise treadmill test. As we said, to start the ball rolling, it's a good way to do this. I want to make a point to just reiterate that we here at Smarter Heart University are here for you. We learn something every time we prepare this for you. We hope physicians, and we can get more and more physicians to tune in so that they can improve their acumen of how to talk to you better. But the most important thing is, if one person learned something today that's not in our office, we know we've made a big difference. And we want to continue to make an impact more and more as we go forward with future shows. Next week, we support the American Heart Association with a live broadcast from one of the Shoreline Heart Walks, this one being in Long Branch, New Jersey. We'd like you to tune in and hear stories of survival and triumph over heart disease. Dr. Kaiser is going to be local on the scene, and he's going to be interviewing patients along with one of our biggest supporters and heart surgery survivor herself. I'd like to give a shout out to Jim. Have a happy and healthy birthday. Lauren, you're in our thoughts and our prayers, and we love you. And Kimmy, you're also in our thoughts and prayers, and we're wishing you the best of luck. Thank you for tuning in this week. Remember, get to it before it gets to you, folks. Have a great week and stay healthy.